Hello, we will be discussing the nutritional needs while pregnant. So, healthy diets during pregnancy are really important. Pregnancy initiates many physiological changes to the maternal body. Incorporating a healthy diet routine improves infant outcomes, including full-term delivery and proper fetal development. A brief outline of several macronutrients, vitamins, and minerals particularly important during fetal development are provided. The first trimester. Within the first trimester, or from the point of conception to 12 weeks, there are numerous physiological changes occurring to the body. Focusing on blood volume expansion, you will learn what is happening within your body that relates to an increase in blood as well as plasma volume and the prevalence of edema in legs and feet. An increased blood volume. Plasma levels increase in order to expand blood flow and transfer nutrients to the fetus and maternal tissue. The body gains water weight due to the increased levels of plasma, and plasma levels begin to increase within a few weeks of conception. The increased plasma is the primary cause of fatigue and exhaustion while being physically active. Nutrients to focus on in the first trimester. The following is a list of the most impactful nutrients throughout pregnancy. Some are specific to the first trimester, while most are vital throughout the entirety of fetal development. Protein. Protein is essential for the synthesis of new and maternal tissue. Carbohydrates. The fetus utilizes carbohydrates as the main source of energy. Dietary fiber. Fiber lowers the risk of glucose intolerance and also helps to prevent constipation. Fluid intake. An increase in fluid intake aids in digestion and helps to form amniotic fluid around the fetus. Calcium. Calcium is a nutrient needed to support plasma volume expansion and the transfer of minerals to the growing fetus from the blood. Vitamin A. Vitamin A supports cell differentiation. Vitamin D. Vitamin D supports fetal growth, tooth, and bone formation. Sodium. Sodium is essential, and an adequate supply is needed as the water level of the body increases. It is not necessary to decrease sodium intake during pregnancy. Iodine. Iodine is essential for thyroid function, energy production, and fetal brain development. Folate. Folate is particularly important in days 21 through 27 after conception. It is essential for fetal growth as well as the proper development of neural tube, brain, and heart. Iron. Iron decreases the risk of preterm delivery and low birth rate. It also aids in proper development of intelligence, language, and gross motor skills. Choline. Choline helps to regulate gene function, neural tube, and brain development. Included is a listing of recommendations and sources in which to find these items in a normal food supply. The recommendation for protein is to consume approximately 71 grams daily. Protein can be found in lean meat, poultry, fish, seafood, lentils, eggs, cottage cheese, peanut butter, and tofu. Carbohydrates, it's recommended to consume 175 grams daily. Carbohydrates are found in many things, including vegetables, fruit, whole grains, milk, and cheese. Dietary fiber, 28 grams daily. Fiber can be found in lentils and beans, whole grains, oats, vegetables including broccoli, avocado, and okra, carrots as well, fruits including pears, raspberries, bananas, and strawberries. Fluid. The best way to get fluid is water. One can also consume milk or a non-dairy product or non-caffeinated tea. Calcium, it's recommended to have 1,000 milligrams daily. Calcium can be found in many places, including spinach, salmon, dairy, as well as fortified juice or cereal. Vitamin A, there's a range between 5,000 and 10,000 IUs daily, not to exceed 10,000. Vitamin A can be found in leafy green vegetables, red vegetables, cantaloupe, eggs, dairy, and beef liver. Vitamin D, 600 IU daily, can be found in fish, as well as fortified milk or juice, eggs, and sunshine will help the body create its own vitamin D, so multiple exposures to the sun during the day are essential. Sodium can be found in table salt, as well as olives, nuts, seeds, and cottage cheese. Iodine can be found in iodized salt, seaweed, shellfish, eggs, and dairy. Folic acid and folate. Folate is naturally occurring in foods, while folic acid tends to be a supplement. So folate can be found in spinach, beans, asparagus, and oranges, while folic acid can be found in fortified things. Iron, 1,000 milligrams daily, can be found in lean red meat, poultry, spinach, and beans. Choline, it's recommended to have 450 milligrams daily, can be found in egg yolk, salmon, and legumes. The overall calorie consumption should increase approximately 300 kcals daily. This does vary depending on physical activity and any pre-existing conditions and pre-existing diet in general. Included here is my research page, which includes the Mayo Clinic's website, the myplate.gov website, and our textbook. Thank you.